Good morning. My name is Sarah Callahan. I am Cree, Métis, and Irish, and I am a master's student with the Masters of Public Health here at UVic, and this is my culminating presentation. My practicum was completed at the Ministry of Health in the Maternal Child Department, and my presentation today will focus on the creation of recommendations for equitable distribution of the provincial parent resources. I'd like to acknowledge the traditional Coast Salish lands that we're meeting on today, and I'd like to take a moment to recognize Melanie Foster and Chelsea Peddle, who are my practicum supervisors at the Ministry of Health. The instructors here at UVic, and Dr. Nigel Livingston and Dr. Kathy Worthington, and I would really like to take a moment to recognize my employer, First Nations Health Authority, and specifically Brennan McDonald, who is the Vancouver Island Regional Director, who provided me the space and opportunity to complete my practicum while continuing full-time employment. Because of that, because I was employed full-time, I ended up doing this over the 2 semesters, and it naturally fell into a split of 2 parts. So the first part was the revision of Baby's Best Chance, Toddler's First Steps, and the Child Health Passport. This work is part of an annual revision cycle, and my piece of this work was completed in December. The second piece of my practicum looked at the recommendations. So historically, approximately 50,000 copies are printed annually of both the Baby's Best Chance and the Toddler's First Steps. However, with a trend for information gathering shifting to greater online access, the Ministry of Health has decided to reduce the total number of each of the resources being printed, and they're now printing approximately 35,000 of each annually, which is just not enough to blanket distribute or provide one for each family for every baby born in BC. Therefore, there is a need for an informed distribution plan. So the second part of my practicum focused on looking at providing recommendations for the distribution of the available print copies, and this will be the focus of the rest of my presentation. So I started with a lit review and looking at the concepts of proportionate universalism and equitable distribution. So proportionate universalism, according to a UBC policy brief, it refers to programs and services and policies that are universal with a scale and intensity that is proportionate to the level of disadvantage. Regarding resources are distributed in a universal or blanket approach to the entire identified population with tailored strategies for the subpopulation. And in terms of Baby's Best Chance and Toddler's First Steps, the universal approach is now going to be online content for everyone to access, with targeted strategies will be the distribution of the print copies that are going to be for identified subpopulations. And in this case, the subpopulations are people who have limited or no access to the internet. And I think it's really important to recognize here that lack of internet access is not always associated with socioeconomic status, and that is actually because of barriers related to remote access with limitations to connectivity, which I'm going to talk about in a minute. So this is just an example of proportionate universalism. It's a graphic visual example. This is the universal approaches are the parent benefits for the new moms and dads or health child check-ins, which are available to everyone. And then the targeted or tailored strategies are the follow-up from the check-ins or the minimal benefits aimed at eradicating poverty, which are focused for the specific identified subpopulations within the larger population. So in looking at the concepts of equitable distribution, I first want to define what does equity mean. I think we've all seen this graph here on Facebook. For equity relates to a sense of fairness and can be confused with equality. However, equality is giving everyone the exact same thing, whereas equity is giving everyone what they need in order to have the same experience, which is what those cases that they're standing on identify. In terms of equity in healthcare, in 1986, the World Health Organization explained that equity in health implies that ideally everyone should have a fair opportunity to attain their full health potential, and that no one should be disadvantaged from achieving this potential if it can be avoided. With Baby's Best Chance and the Toddler's First Steps, as there are a limited number of these print print resources now, providers must ensure equitable access for all new parents. And if the resources are to be put in their most productive use, according to Birch et al., in terms of promotion, protection, and restoration of well-being, then they must be allocated between populations on the basis of the relative needs for care. Therefore, we want to ensure that all new parents have the same opportunity to access the information within Baby's Best Chance and Toddler's First Steps and negate any potential for barriers to access, which would be inability to access the internet. So a survey of vulnerable clients conducted by the Ministry of Health in 3 health authority regions found that 75% of participants indicated internet access via a home computer and 55% indicated access to a cell phone. So these figures actually demonstrate that internet access is not universal. So within the BC context, issues within online access are related to 3 things: connectivity, affordability, and literacy. So regarding connectivity, BC is a vast province with many remote communities who experience challenges to internet access. According to the BC government, high-speed internet is available to 94% of BC households. However, that statistic does not indicate usage. It only indicates availability. So for example, fiber optic lines may be available for community to connect with, but because of significant costs, the community may not be able to afford the connection costs for the last mile to provide service into community. And the last mile is the final connectivity leg between the telecommunications service provider and the individual customer, or in this case, community. In BC, baseline infrastructure is not in place or available in all communities. The internet is accessible through 3 different means. One is land-based dial-up or phone service. The second is cellular phone data. And 3 is computer-based web. So in BC, cell phone towers and or fiber optic lines are not in place in all of our communities. And dial-up internet, while accessible, is slow and does not provide the bandwidth required for optimal viewing of both the Baby's Best Chance and Toddler's First Steps. So the second piece around issues is around affordability, and affordability can be broken down into 2 separate parts. The first part is community affordability. So community internet access requires commercial grade service. And what that means is that for us as individuals, we have consumer grade service, which is commonly used by individuals or small businesses, and we share the bandwidth. And often this is referred to as best effort service, whereas best effort services oversubscribe the bandwidth, which is sold, and compared to what's actually available, because not every customer is using their connection at the same time. Whereas consumer grade service, which is not appropriate, consumer grade service is not appropriate at a community level as it will not support bandwidth which is needed. So therefore communities require commercial grade service called dedicated internet access. However, this is very expensive and often not affordable for smaller communities. As well, the cost to run technology over fiber optic lines along with maintenance and upgrading can provide to be too costly. And the second piece around affordability is individual affordability, which is a person's ability to afford a home computer with internet or a cell phone with data. And then the third piece is around literacy, both language literacy and computer literacy. And with the parent resources, the aim is that they are low barrier, but it is recognized that there's improvement needed for literacy accessibility, and more so with the online content than with the print resources. The second piece I wanted to talk about in the BC context is around the healthcare providers. So the parent resources are currently provided to healthcare providers working in health centers, as they're viewed as an optimal resource with consistent information, which is based on best practice, and they're also ideal for using with in-home care provision. And then the third piece around BC context is subsequent birth. So really, it was a difficult word to come up with on how to describe this, but what that means is that people who are having their second or third or fourth or so on child past their first one, with the parent resources, every family with a baby receives the latest copy, including those that have had previous children and have previous versions of the resources. So my recommendations based on all of that. First was to encourage online access for people who were provided with a copy of the parent resources with a previous child, with a caveat that they would be shown what the revisions were to the version that is currently available. And secondly, to encourage online access to anyone who has a home computer or a cellular phone with data. And the second piece of the recommendations was to provide print copies of the parent resources to people who have limited or no connectivity, who do not have home computer access, who have limited or no access to high-speed internet, and the high-speed internet is what is needed for optimal viewing of the two resources, or who have an inability to afford the cost of data transfer, and who are challenged by limited language literacy levels and computer literacy levels. And finally, healthcare providers who are doing home visits and working in a health center with limited or no access should be given a copy, and those who do have access should access online for modeling purposes. That's all. Strengths and challenges we'll skip. These were my challenges and strengths. Thank you.
And thank you for your super fast and gracious wrap up. So who knew that internet connectivity was an equity issue? All right, so questions. Questions.
Hi, Sarah, my fellow FNHAer. I'm so excited. We both work for FNHA. So it's always a challenge to identify who has connectivity, who doesn't, and how would you go about, I understand the recommendations and that's just normal, but how would you go about finding out who does and who doesn't, and then connecting them with paper or online?
So it's, this is one of those things where we recognize that the closer you get to the community, the better expert in knowing what is needed. So with the Ministry of Health, the resources are distributed to each of the health authorities based on the population of births, and then the health authorities are then responsible to distribute those into the specific communities. And then the next step with that would be then working with the health centers to identify where there are issues around connectivity and where there's not. Does that answer you?
Yeah. Mm-hmm. Other questions? There's one.
Hi. So I did my BA practicum base case, and a lot of what we did in mine is working with remote older adults. And one thing that we kind of came to the conclusion of was the same thing. They don't all have access to internet services. Do you think that finding a way to implement these, are they called baby books or?
Parent resources.
Parent resources. Do you think that it would work to have them kind of in a community center and then they get distributed from there and potentially brought back almost in like a library way? Because that was one thought that we never continued on, but I wonder if it would work.
Actually, I think that's a really fantastic idea that we hadn't considered. But yeah, definitely a sharing system. The way it works now is that the health care providers that are going into home have the copies so they can go through them, and then they will leave them if it's needed, or they will model the internet, like going through the internet and showing people where they are at. But I like the idea of
we should
sharing.
Make a healthcare library.
A library, yeah. Yeah, definitely.
Thank you.
Okay, I think I'm not seeing any other hands, so thank you, Sarah.
Thank you.
I think next up